Now talking about the curvatures, so we have this lesser curvature and then we have the greater curvature. So this lesser curvature is J shaped and this is more fixed and form the right border and lie on the most posterior plane than on the in comparison to the greater curvature. So lesser curvature give attachment to the two layers of the lesser omentum which contain the anastomosis of right and left gastric vessels close to the curvature. So these vessels which are visible over here are the branches of your right and left gastric and artery anastomosis. Talking about the greater curvature which will form the left border of the stomach and it is more superficial, more mobile and it is 4 to 5 times more longer than the lesser curvature. So it begins at the cardiac end and it goes upward, forward and to the left forming the fundus. So the uppermost part, as we already talked in the previous video, so the uppermost part is the fundus and it is usually filled with the air only, and then we have the greater curvature. So this greater curvature is giving attachment to the two layers of the greater omentum which encloses the anastomosis of right and left gastroepiploic arteries. So these arteries which are visible over here are the branches of your anastomosis of the two arteries. So at the cardiac end, if we talk about, it will give attachment to the gastrophrenic ligament which will go from here to the diaphragm, and then opposite to the fundus it will give attachment to the gastrosplenic ligament, and rest of the curvature will give attachment to the greater omentum as we talked.